Hello, my name is Uwanogho, and this is the role of emotion and motivation in panic disorder. Uh, the outline will be panic disorder, an introduction, physiological processes involved in panic disorder, fight, flight, and freeze responses, potential causes of panic disorder, comorbidities of panic disorder, and evidence-based. So, what exactly is panic disorder? Panic disorder or attacks, defined by the Diagnostic and Statistical Manual of Mental Health Disorders, also known as the DSM, as an abrupt surge of intense fear or discomfort, reaching a peak within minutes. And about four or more of a specific set of physical symptoms accompany a panic attack. And these symptoms include, um, but not conclusively of a list. These include palpitations, pounding heart, accelerated heart rate, sweating, trembling or shaking, sensation of shortness of breath, feelings of being smothered, feelings of choking, chest pain, nausea, abdominal distress, feeling dizzy, unsteady, lightheadedness, or faint. Uh, those are just a few, from a conceptual standpoint of what panic disorder is. So the role of the sympathetic and parasympathetic nervous system, the SNS, which is the sympathetic nervous system, plays a primary role in panic attacks. One of the first things it does is it triggers the fight or flight response. It also causes physical symptoms, like increased heart rate, sweating, rapid breathing, dilated pupils when activated during a panic episode. The body also perceives a threat and reacts with physiological changes to prepare for immediate action. The role of the sympathetic, sorry, the parasympathetic nervous system, which can also be called the rest and digest grid. It's responsible for a calming down of the body during a panic attack. It brings the body back to a relaxed state as it counteracts the fight or flight response triggered by the sympathetic nervous system. Uh, there's a caution here, though. If the parasympathetic system fails in the aforementioned roles that we've described above, um, in terms of calming and counteracting, the heightened arousal of a panic attack can persist, which can sometimes have some catastrophic consequences. Um, So neurotransmitters and hormones involved in panic attacks. So the neurotransmitters involved rather in panic attacks include serotonin, which closely connected with sleep, mood, appetite. Dopamine, energy, attention, rewards, and movement. Uh, Norepinephrine, which is released in the fight or flight response, and the GABA, which is the gamma aminobutyric acid, also called GABA, which creates some kind of a balancer or balancing act of excitement and or agitation, whilst also helping to activate feelings of calm and relaxation in stress-inducing situations. The hormones involved in panic attacks, yeah, these include adrenaline and cortisol. And the final process, these are the final processes of the human body released during a stressful situation. Again, adrenaline and cortisol are the final process of the human body released during a stressful situation. What's of intrigue here for me was the how this is released. So it's amazing. So the amygdala sends a call of affliction, like I called it, to the hypothalamus. The hypothalamus then sends a beacon, to the adrenal glands to discharge adrenaline and cortisol into the bloodstream. So these hormonal surges help in the activation of increased heart rate and breathing and sweating, amongst other things. Um, the next um, topic or subtopic will be the fight, flight, and freeze response to panic attacks. So, in terms of the fight response, the activation of a fight response is an indication that the body is invigorated to cope aggressively with a perceived threat. The physiological responses, might include a clenched fist, um, adrenal rush, high blood pressure, increased heart rate, and the like. That's for the fight response. For the flight response, this response is induced by a fear factor where the person has the urge to run away for fear of harm. Self preservation, I guess, is a good way of actually putting it. Like in the fight mode, a rush of adrenaline and increased heart rate preps the runner for escape. Uh, Flight also includes feelings around fidgeting, feeling trapped, panic. These are all telltale signs of a flight response. Then the freeze response, so unlike the fight and flight responses that actively increase stress responses, freezing, on the other hand, forces the body into shutdown mode. This is characterized by decreased heart rate, dissociation, numbness, immobility of the body, and the like. Um, an etiological listing of potential causes of panic disorders include, but not again, not limited to, chemical imbalance, which includes abnormalities in GABA, cortisol, and serotonin. It also includes genetic and biological predisposition. You know, you know, I think I read somewhere that about 40% of first generation clients, predisposed to having panic disorder within the same familial line. That's under genetic and biological predisposition. Environmental factors include stressful life events, substance and alcohol use. Stressful life events, as a clinician during the uh, 2001 attacks on the US. I remember one of the aftermath was having a lot of people, with issues with panic attacks because they had never seen such scale of brutality, at least not in the US before now. So again, environmental factors like stressful life events, uh, grief and bereavement, um, natural disasters. We also have substance and alcohol use. Usually, when people, indulge and engage in behaviors around alcohol, it tends to increase the potential likelihood of that, of panic attacks. Then we also have cultural factors, and what I saw here was that sociological norms and practices have tendencies to foreshadow panic attacks within a community. For example, in different parts of Africa where they have different rites of passage, where they have to go kill a wild animal or they have to take a lot of beating without actually having to shake. Uh, those are stressful situations that tend to be um, raise the specter of panic attacks. Comorbidities of panic disorder. 98% of panic disorder clients or patients are reported to have at least one comorbid lifetime DSM-4 axis 1 disorder. And It's no surprise that major depressive disorder, MDD, was the most common of psychiatric disorder associated with panic disorder. It was also reported that over 70% of patients with panic disorder had another lifetime anxiety disorder. Uh, Furthering that, he says 40% also had lifetime alcohol use disorder. In terms of evidence-based treatments for panic disorder, so available medications include SSRIs, which fall under antidepressants. It's worth noting that SSRIs are usually considered the first line treatment for a panic disorder. These include fluoxetine, paroxetine, and citrulline. Other medications, which fall more under the anti-anxiety medications for panic disorder, these include benzodiazepines like alprazolam, which is used after the SSRI takes root. In terms of therapeutic techniques, we have CBT, cognitive behavioral therapy, and CBT can be modulated, or adjusted to include exposure therapy, cognitive restructuring, and breathing retraining. There's so many manuals that actually talk about breathing as a part of helping the client or the patient suffering from panic disorder. In terms of needed support for panic attack, uh, it all comes down to education, education, education. So thorough education on the disorder between and among treatment teams for the patient. Information must be provided of different treatments available and need for utmost compliance to the client too. Strict warning against alcohol and recreational drugs. This one usually will come from the um, pharmacist. Incorporating the patient's family and social support network, activating accommodations, where necessary, like at work and at school. It goes a long way in helping to not isolate the client, and it also helps them in adapting to this new experience. Variants of treatment and treatment outcomes for panic attack in different communities. Culturally adapted therapies are of critical importance for the treatment of panic attack. Religious and multicultural considerations matter. Immigrant communities where language barriers and high degrees of mistrust are high must be factored during treatment, and community outreaches and collaboration with interpreters bridge the schisms that divide most communities within the medical world. Um, where this currently exists, it becomes critical that you know community outreach is very very important and critical. I think that will be all. The next three pages references. So this ends my uh, PowerPoint presentation on the Activity 11 module, for this particular topic. So the class has been great. Really appreciate this, and I hope it works. Thank you.